Good morning, everyone. Again, my name is Robin Weiner. I am the Managing Director at Dataluz North America. I'm part of the team bringing Dataluz to Canada and the United States. You probably haven't heard of us before, but Dataluz is one of the top 3 per-play healthcare companies in the world. Dataluz is headquartered in Italy, but we're in over 40 countries around the world. Dataluz products are in over 630 health organizations, and we're currently serving 530 million people all over the world. We are excited to bring our 40 years of experience to Canada, and Dataluz is looking to create long-term relationships and partnerships. My colleague Jennifer Bowers and I will be here all the next couple days, dying to meet you all. Come up and talk to us. Now, I have the pleasure of introducing Dr. Alex Barron. Alex is the Chief Staff and Director of Quality Management Care at the London Health Science Centre in London, Ontario. A pediatric immunologist and oncologist, he's the founding member of the Board of Directors of Ontario Health and the member of the Board of Directors of Canadian Medical Protection Association. Dr. Barron was deployed in Afghanistan in conjunction with the Canadian Armed Forces and the Canadian International Development Agency to coordinate forward operations in maternal and child development and healthcare programs. Most recently, he founded and is the director of the Step Forward Foundation for Child and Youth in the remote rainforests regions of Ecuador. Dr. Barron will share his extraordinary journey from the front lines of healthcare and offer insights to the connected care for healthier Canadians. Let's welcome Dr. Barron.
Well, thanks so much for such a wonderful introduction. My background is I'm a pediatric hematologist oncologist, so my area of particular interest is children with leukemia, but I also work in the emergency room, and I was on staff at the hospital for sick children for many years and recently just changed and moved to beautiful London, Ontario. A lot of you would have seen this one. So I thought, we got to start with at least a little bit of humor. I was given that by my son. So I did a very foolish thing a number of years ago. I decided to go back and learn about digital health at my age. And I went to MIT because I thought they had one of the best programs in the world. And I thought, I'm going to learn about Python coding. So the very first assignment that we had, we were given 2 weeks to produce coding to solve a problem, and we were given 50 lines of coding. That's all you could do, 50 lines, no more. So I worked on this thing diligently, and I literally did work on it diligently. I mean, hour after hour after hour, and I have a brother-in-law who's a coder, and I did not call him because I didn't want to cheat. And at the end of this thing, after I got it in with 48 lines of coding, and I thought I was the smartest coder in all of Python history. And then we got together in our group, and it was virtual, and we had people from all over the world. And this one young man, who I'm going to guess was probably 21 or 22, he was so polite and so deferential, kept calling me doctor, doctor, doctor. He said, Dr. Barron, I'm just wondering if you might have considered using these things called macros, because actually I've done it in 1 line. And so just when you think you know everything, it's a very humbling moment to realize that, there is always a lot to learn. And I'm very humbled and honored to be in front of this group who is brain trust that is unparalleled in Canada. And you have those imposter syndrome moments where you kind of wonder, why am I here? But I'm here, and I'm going to take you on a journey, because we talked about going on journeys this morning. And when I showed my wife what I was going to talk about, she said, Alex, this is either going to be a hit or an absolute, complete, and utter miss. So we'll see which one we're going to get today. We're going on a journey, and we're going on a journey into the deepest parts of the Amazon basin. Usually there's sound with this, but that's okay. So here we are going down the Amazon in a canoe. And we're going into an area called the Cutucu in southeast Ecuador, which borders on Peru. And we're going into that region. So why on earth are we going into that region? The reason that we're going into that region is because we're going to try to help. And when I say help, I mean this is a group of people who asked for particular things. We spend a lot of time talking with them, asking them what they wanted. And what group am I talking about? Well, I'm talking about, and some people will know who this group is and some people won't. These are the very proud Shuar, pronounced Chuar, people of this area of South America. I picked that picture because it kind of looked like those three birds and then the other bird sitting there and all these kids sitting on Wi-Fi, but they're actually sitting on a stool. So it was a bit of a cheat. But this is a group that has been in this region for tens of thousands of years. And many people think probably 22 to 24,000 years. And in all of that time, there's a number of things that they've never had. They've never had clean water in 24,000 years. They've never had any medical care whatsoever in 24,000 years. They've never had any schools built in any of their villages in 24,000 years. So we look at what we're trying to do at Infoway and in Canada and connecting people. It's really a larger scale, much larger scale, of what these people want, which is health, education, and clean water, which is part of the WASH program, the World Health Organization's has deemed this a priority. So how do we get this to them? How do we give them what they've particularly asked us for with their help? And I just wanted to show you that they don't dress like that all the time. They dress like that for ceremonial purposes. But here's a group of Chuar children. And I have to say, being a pediatrician, this is the most absolutely lovely, gorgeous, beautiful group of kids you've ever met. This is a group of kids who have, compared to Canadian kids, absolutely nothing and spend all their time smiling. It's hard to explain, but they do it. So I was asked specifically to talk about this, which is the quintuple aim. We're going to hear, I'm sure, a lot about this over the next couple of days. And I'll also say, I'm not going to mention, we're not going to talk about data. I know, at a tech conference, we're not going to talk about data. My wife said to me, you're not going to talk about data. That's why she said you're going to, anyway. We're going to talk about equity inclusion, because what we're trying to do at Infoway has to include all elements of that quintuple aim. When we look at number 3, which is reducing costs, I know there are a lot of people who agree and disagree, but my sense is that it's not about reducing costs. What it's about is creating value. So we have to look at things a little bit differently. There are some healthcare systems that focus on the cost element. My sense is we should be focusing on creating value. But equity and inclusion are the elements that were brought in over the last few years, and this particularly applies to the Shuar people, because they have literally been forgotten by their government. Now we're going to just drop back a little bit. I think everybody saw this headline in the newspaper a couple of weeks ago. And when you see it and you work as hard as everybody here does, it's extraordinarily discouraging. You say to yourself, are you kidding me? We work so hard on all the things that we do and it made no difference. Well, I can tell you at Sick Kids or at St. Joseph's Health Center where I worked, we knew it made no difference. We had just as many kids or more kids coming in to be assessed despite having had virtual visits over and over and over and over and over again. And when we asked, we got the same answer, which was, I want my child to be examined. Doesn't seem like an unreasonable thing. The number of kids that we had who came in who had burst appendices, who had been assessed virtually and told it was a tummy ache, but mom or dad or caregiver just had a sense that they knew their child and this was not a typical tummy ache, and brought the child in. And by the time I saw them and did an ultrasound, point of care ultrasound, unfortunately that appendix had burst. So the question is, how do we create virtual care for acute conditions? So for mental health issues, this was a godsend for us. For long-standing issues, this was wonderful. For acute issues, we still had challenges. And we had those challenges in Canada. We had those challenges all over North America and all over the world, where we continually heard that despite this being virtual care, and this was virtual care set up in hospitals doing their best. These were our emerge docs talking to families. We still need that last thing, which is that hands-on approach. When I was in med school, we were always taught that 90% of medicine was history and 10% was physical exam. So when we do acute care, virtual care, unfortunately, as it stands right now, we can't do that 10%. So it's wonderful, except that we can't get all of it done. So here's actually what we have right now. And it's kind of the elephant in the room. We don't have virtual care. It's telephone care with a video. It's telephone care with a video screen. And the telephone was patented by Alexander Graham Bell in 1876. So the technology that we're using right now is technology from 1876, or if you're a purist, probably from France from earlier than that. So the question is, for acute care, how do we move it forward from a telephone with a video screen to something that actually will make a difference for all of Canadians, which will actually be virtual care rather than telehealth or care with a telephone and a screen. So that's going to be a little bit of my challenge to everyone today. So we'll get back to our journey into the Amazon. But before we do that, I wanted to go over a couple of things. And these are important. Everybody here has a strategy. Everybody here has their own strategy. But the strategy, at least in my humble opinion, should be that we're trying to make all Canadians better. We're trying to make our healthcare system better. I'm trying to make the kids that I look after better. So I'm going to try to employ this technology to do this. And Michael Howard was a professor at Oxford for many years, and he was actually a professor of military strategy. But many people believe that what he has talked about and the way he has drilled down on things is absolutely correct. And I remember when I was doing my MBA, this was taught to us as well. There are 4 elements of strategy. And to be successful, you need all 4 elements. So number 4 is technological. That's what we're here to talk about this weekend. But as we go through some of the slides that I'm going to show you, and what we did for the folks in the most remote regions of Ecuador in the Amazonian rainforest, I want you to think, whenever you see a slide, about which element of strategy this represents. Because you need logistical, you need operational, you need social, and you need technological. You need all of them. So if we talk for the next couple of days all about technology, and we don't talk about the fifth part of the quintuple aim, equity and inclusion, or we don't talk about social buy-in, or we don't talk about how we operationalize it, or the logistics behind creating a digital health system, we probably won't be as successful as we might otherwise be. So we need always, no matter who you are, whether you're a vendor, whether you're a content creator, whether you're an AI, it doesn't matter. We need always to think about all four elements if we're to be successful. So this is a young lady in a village known as Cascadas. Cascadas means rainfall, or it means waterfall in Spanish. I'm sure there are some people who speak Spanish here, and it will be much better than mine. But this young lady walks about 2 hours every day, each way. That's 4 hours altogether to collect water for her village. And she's not alone. There will be a whole group of young ladies all lined up, and they're all girls sent by their village to do this. The boys are not sent, girls are sent to do this. The water is full of all sorts of nasties, particularly E. coli and something called helminths, which, as I'm sure a bunch of people in the room will know, are worms. And those are not fun to have. It also has heavy metals in it. And the 4 hours that this young lady takes to go back and forth to her village means that there's one important thing she cannot do, and that is go to school. So even if there was a school there, she's not going to be able to go there because she has to go and get the water every single day, 7 days a week. And she has to pick up this impure water that's full of all sorts of nasty things. So this is a group of men in Cascadas bringing up an interesting device. So again, you're putting your thinking caps on and you're saying to yourself, what elements of strategy is this? Here are a few of my thoughts. You don't know what that is, but what I'll tell you, and you'll see in the next slide, it is a fascinating piece of technology. But to get it there, if you remember going back to that very first part of the video, required the same canoes that I went up on and I go in and out of the villages in for hours. So it took the logistics of moving this piece of equipment all the way up hours through the Amazon. Now it's small, so we could actually fit it onto the canoes. We had to operationalize it. We have to actually make this thing work. And you'll notice that the people with the big smiles there at the end of this video are two gentlemen from the village. So we have the social buy-in of the village. We have the people who want this to happen. All four elements of strategy. So we have logistics, we have operations, we have social, and we have technology. So we're on a good start. Doesn't mean it's all going to come to fruition, but we're off to a good start. And this is what this piece of equipment is. This is a solar-powered, ultraviolet light water purification system. It's sourced out of Calgary, so it's Canadian. It's small. It doesn't require any batteries. And it can purify enough water every single day for that entire village. Every single day. And it's a remarkable piece of machinery. You can stick it on one of those canoes and you can drive it all the way up to the Amazon, place it in the village, and there's virtually no maintenance required. One of the wonderful things about the Amazon, at least before 3 o'clock in the afternoon, when the rains come, and they come at 3 o'clock in the afternoon, is there's a ton of sun. So the fact that you've got a ton of sun means that that thing produces an incredible amount of water for that village. But still have to operationalize it. You still have to set the thing up. So again, we're going to put our thinking caps on. We're going to look at this slide and we're going to say, which 4 elements of strategy does this slide represent? Well, those pipings are pipings so that we could provide water, not only at a central location, but to every single residence in that village. So every single residence would have fresh water. And look who's doing the work. What a surprise. Look who's doing the work. It's the villagers. The people who live in the village are doing that work because they're bought in and they want this. In the back, we have our engineering team who volunteered their time from Quito. But it's the actual villagers themselves who are doing the work. So we have the logistical element, which is you got to have the piping. You've got to operationalize it, which is what they're doing. You have the social buy-in, because these are the people who want this water. And we have the technology, which is going to be that solar-powered UV light filtering system. Again, we have all 4 elements of strategy. So again, so far so good. When you do it, this is what happens. You can see the smile on the faces of the people in the village who are holding little cups of fresh water. There hasn't been fresh water in that village for 24,000 years. You can see that they all came around. That's Joey, who's our chief engineer, a remarkable guy who's completely dedicated, volunteers his time, volunteers the time of his company to do this out of the capital of Ecuador. And you can see the smiles and the pride on the faces of the people who have been part of this solution and made all of this happen. It produces leader after leader after leader after leader of fresh water. And again, there is this gentleman is the syndico. The syndico would be the equivalent of the chief or an elder in Canada, who is holding up the first big bottle of water that's ever been created. And you can see the look of pride on his face. So by employing all 4 elements of strategy, making sure that we had logistics covered, making sure that we could operationalize things, making sure that we had the social buy-in, and making sure that we had the technology itself, the village, we didn't create anything. The village created all of this. They wanted it, they asked for it, they created it themselves. And here is, again, this is one of our engineers. We set up a central shower area and central latrine for this village. So they now have a central latrine, central shower area, and they have water in every single residence in this village. And the kids themselves now will grow up, not having to walk 4 hours every single day to go and get water for their village. Now their time will be better spent doing other things. And hopefully that's a generation of kids that will grow up never knowing that this had to happen in 2023, because now it doesn't have to happen. We're going to turn our attention to medical care. So that's fresh water. Medical care is very different there. These are 2 different babies from 2 different families. The little one on the left is premature. The little one on the right is premature, but not as premature. And they have to share an incubator because services are rationed. That's all they have, and they do their best. What I can tell you is that fortunately, both of these babies had a tremendous outcome, which was wonderful. So we turned our attention to the next thing of employing those 4 elements of strategy. And the next thing was, we've got fresh water. What would it mean to build a medical clinic, an actual medical clinic in one of the villages? Is that something that you would want? And of course, the overwhelming answer was yes. So to do that, again, we need all 4 elements of strategy. So we had the logistics. Now this clinic is not as deep in the Amazon as Cascadas is. So we were able to bring in the materials in an easier way, but we still need all the logistics to bring on all the materials to build this. We still need to operationalize it. We still need the social buy-in. Because if we build this thing and nobody comes, it's a complete waste of time. And there's going to be some technology associated with this, isn't there? Because we've already talked about the fact that always there's technology associated with these things. So here we are. The 2 gentlemen on the left are the syndicos of the 2 closest villages, who again are so proud at what they've created because they created this. The 2 villages created this. We didn't create it. The 2 villages created this. On the right are 2 of our doctors and 1 of our nurses. The doctors travel in every week, and the nurse travels in every week, and they rotate in and they rotate out. But they operationalize this clinic. So we have the logistics to get it up. We have it operationalized by our staff. And we have on our left the social buy-in of the syndicos or the elders of the 2 closest villages. So where's the technology? So the technology is sometimes as simple as a measuring tape. None of these kids had ever had a physical exam done before in their lives. So here's a group of kids outside these little ones are between the ages of 4 and I think 6. And they line up very differently than they do in my office. They line up very politely and they're quiet and they're excited about this crazy guy with a measuring tape and why is he going to do all this stuff. So we measure them and we weigh them and we start with those very straightforward statistics. So something as simple as a measuring tape and a weighing scale is, in this area, technology. Vaccinations. Again, we're saying to ourselves, that doesn't sound like technology. Well, creating the vaccine, again, 4 elements of strategy. You need all of them. But the disposable plastic hypodermic needle, up until the 1970s in many places, and up until as recently as now in some places, needles are glass, and they're still glass, and they're not disposable, and they can't be used again and turned around. So providing disposable hypodermic needles to make sure that all the kids got their vaccine, and having those village elders make sure that they go around and bring in all those kids so they get their vaccines, tetanus, diphtheria, et cetera, that shows that we've covered all 4 elements of strategy. And then this is just a small part of it. This is just a small part to show that we have medication. And we have the medications that make a difference to these kids. And the medications are things like anti-worming medications. There's things as straightforward as acetaminophen or ibuprofen, things that we take for granted here, but to them are a big deal. So now we've done 2 things. We've created fresh water. We've created a medical clinic that's staffed by physicians and nurses. And there's one more big element to this, which is education. We wanted to have all 3 of those because the overall strategy was not to create a medical clinic, was not to create fresh water. The overall strategy is to make the people of these villages, help them be better, is to listen to what they want and fulfill their requests. And they know exactly what they want. They want fresh water, they want medicine, and they want schools. So here's a young boy in a school that we built. And again, we had the logistics, we had the operations, we had the social element because there was buy-in from the village, and we had the technology. Now you're going to say, hold on a second, I don't see any operations there, and I don't see any technology there. So help me, unless you're talking about a pen or a book, is that the technology, and where are the operations of this? So I hope there are no people in the room who are squeamish or don't like to fly, because what we did is we built a landing strip for this very remote community, and we fly in a teacher for 4 nights every week, a rotation, and he or she stays in the village for 4 nights in a week. And so you can see the commitment, this is me filming this, but so you can see the commitment of these people to making sure that the kids in these villages have the best possible start that they can. I want you to watch this video. So an incredibly dedicated group of teachers who fly in and out of these villages, and they do it all the time. And we actually, the advantage is, of course, we can now bring supplies into the village. So we're going to go back a little bit to that virtual care encounter and tie this all up. At least I hope so. It's really discouraging when you work so hard, as everyone in this room has, to see those headlines in the newspaper that say that virtual care didn't make any difference at all. Well, maybe it didn't now, but those people in the Amazon 10 years ago didn't have what they have now. And all that happened was a group of dedicated individuals came along and said, we're going to deploy the 4 elements of strategy. And if we do it, we'll be able to partner with these people and give them what they want and what they deserve. So virtual visits, virtual consults, although they're a phone and a video screen now, that's going to change, as everybody in this room knows. And it's going to change because everyone in this room is so dedicated to making it change. In the same way that our teachers are dedicated to flying in like that into those villages, everyone in here is dedicated to making sure that Canadians have better health care. So that phone and video experience is going to change. I'm not an expert on that, so I don't know how it's going to change, but I think one could see very easily how machine learning is going to be a part of this, how predictive analytics. I'm not sure how this will happen, but I do know that there are all sorts of technologies out there so that when you do that phone call and that video screen, you can have your heart listened to, you can have your chest listened to, you can have your pulse taken, you can have your temperature taken. All of that is coming. So when you see that headline that says it made no difference, do not be discouraged, because it will make a difference. It's coming. It made a difference to mental health. It's made a difference to long-standing issues. It will make a difference to acute care too. So everyone, keep your head up, keep dedicated to this, because in the end, we will get to that equity inclusion element of this all over Canada, all over the second largest country on the planet, with people spread from coast to coast to coast. That's coming. That's going to happen, and it's because of all of your dedication. We need to include all 4 elements of strategy, but as I talk to people here, you guys already got this. You guys already know this stuff. So maybe my talk was redundant. But it is important every single time we think of that, that part of technology and how we're going to operationalize, how we're going to use it, that we continue to say to ourselves, hold on a second, there are 3 other elements to this, and I want to make sure that I understand them and that I've thought about them and how they're going to fit in to moving forward with technology. So I'm going to show you my last slide. I tend to be a little faster than typical, but I'm going to show you my last slide, which is my favorite picture in the world. I'm a big believer in joy. I believe that we should all find joy. I find joy in helping, doing what I do in Afghanistan and wherever it is. I love it. That's what keeps me going. I find joy in looking after kids. Old guys like me, a bit more of a challenge, but kids, I love kids. Kids don't complain. They just keep going. And this was a photograph that was taken in 1986 by the Toronto Star. What the Toronto Star did that day, they did something remarkable. They said to all the photographers, I want you all, free rein, go out and photograph the city. Anything you want, 24 hours, and bring back all your photographs. Bring back all your photographs. And the one that was chosen was this picture. That's joy. That's joy of that mother. But the one thing I think people forget is look at the nurse up in the top right corner. Everybody focuses on mom. Look at the nurse. Look at the smile on her face because she knows she's just been part of something incredible. That's joy. That's what we need in Canada. We already have it. We need more of it. That's what that quintuple aim is part of, bringing back joy to healthcare and to medicine. What you're doing will help to do that. And if you carry on your mission and you're steadfast and you're unwavering and you employ all four elements of strategy, you will get it done. And as was mentioned this morning, it's easy to be sitting at a desk or programming or in another meeting and to forget that in the end, everyone in this room is saving people's lives. Every single solitary person in this room who's part of this is saving people's lives. I don't think that's a job. I think it's a calling, and you've all answered it. And I want to congratulate everyone for working so hard, and I want to thank everyone for inviting me to give this talk today. A little different, I know, but I want to thank everyone for inviting me, and I want to wish everyone the best of success over the next 2 days. Thank you.